usually to evaluate the intracranial anatomy, including the continual facts cerebri in different sections, and the transdental and splenium plane, and the pre-midline, and the canal septal porosity CSP here, and the canal body and the anterior half of the lateral ventricles. We should observe the hand shape, lateral ventricle, and the CSP, salami, cerebellum, and the cisterna angle. So the series evaluation of the intracranial anatomy should be performed, include the following items. So we can see this is the front hall, the CSP, and the artery and cardioplex. We can use the machine, just print one key to get all the sections. Let's show you the video. You can get the 3 sections and get the measurement automatically and quickly get them. Wait a moment. So it's very easy to get the 3 sections. The first, I will focus on the anterior complex of the fetal brain. The anterior complex of the fetal brain is a group of anatomical structures, including the canal septal porosity (CSP) and the anterior half of lateral ventricle and the granule of the corpus callosum, periclosus suckers, and this one IHF, interhemisphere the features. So this is the group of anatomical structures. In the axis ventricular plane, the anterior complex can be identified 18 to 100% of the time in the second and third trimester. And it's very important to visualize not only the anterior, the complex, but also structures located posteriorly. The posterior complex is also very important. And in the midline, posteriorly, we can show the spanium of the corpus callosum and the callosal suckers, and parietal occipital fissures here, back here. So we are not only to observe the anterior, the complex of the fetal brain, we should observe the posterior complex, the callosum, corpus callosum. Yeah. So this picture, I will show you how to measure the measurement of the CSP, the cavity of the septal porosity, how to measure. It's bigger or smaller, and the shape, we should observe the shape. So this is, the B is to measurement of the CSP, the lungs, and the widest to measurement to the CSP here. And here is the granule. We can also see the lateral ventricle. So this is the widest of CSP. So usually we would like to use the coronal the views for the hand to observe the anatomy. There's different slides. We can see the IHF, the ventricle, and the genu. And we also focus the frontal house of lateral ventricle here. So if the subject the normal views, we can, in this section we can see the 4 parts of the corpus callosum, including the rostrum, genu, body of, and the splenium. We can also see the relationship with the cavum septal pellucidum and the lateral ventricle. We also can use the 3-dimensional the volume to see the slice. It's very slice for the brain, enhance the image quality, and also obtain the views on the 3 of the ground plane. Here is the we can see the cavity of septal pellucidum also, and the midline ankle, and the front hall of lateral ventricle. And also you can see it's because it's a sliced section, we can see the cavum organ here. So this can enhance the image quality. Use the we can according to the brain pathology, we can see the disease, different disease for the anterior complex abnormalities, including the hollow piercing cavity, and the semi-lobar hollow piercing cavity, and the agenesis of the septal pellucidum, and the secondary cavity, callosal dysgenesis, and including partial agenesis, and complete agenesis, and hyperplasia, and the thin corpus callosum. Also, we should find the malformation of cortical development, including the periventricular heterotopy and other syndromes like Smith-Lamb ulcers and intraventricular hemorrhage and other disease. So, firstly, I will introduce the cavum septal pellucidum. The CSP is small but important structures in the fetal brain. It's a midline fluid-filled structure inside, closed too, but we can distinguish from the ventricular system. We can see the septum here. It's from the corner. CSP is laterally by the anterior half of the lateral ventricle here, and it's superiorly by the corpus callosum, and the inferiority is by the fornix. Usually, CSP is typically formed at 17 weeks of gestation, and throughout gestation, the CSP gradually closed, and after 37 weeks of gestation, it's usually no longer detectable by ultrasonographically. So it's a very important structure. Normal size for the CSP between 2 to 10 millimeter. It's with normal shape. But if absent CSP, it's most associated with some disease, for example, the Holosan precepali and ventriculomegaly, and for central optic dysplasia, genesis of the corpus callosum ACC, and secondary, because we know the failure to identify the CSP. The CSP is a key feature in the diagnosis of the largest spectrum of both holocephaly and niche anomalies, such as the ACC and obstructive ventriculomegaly. So we should consider the CSP as the marker of abnormal central nervous system. So the CSP below the 2 mm, what were we found for this case? Yes, it's below. It's very small for the CSP. The picture, this one is very narrow. Cavern receptor velocity. And 23 weeks is just 1.9 millimeters. The fig B shows this. The partial genesis of the corpus callosum, and this is confirmed by an RI. So, if the CSP is smaller, what will be found? For this case, we found it's a partial genesis of corpus callosum. If the CSP is larger than 10 millimeter, what will be found? What should we think about? The fetal lateral ventricle cross-section shows widest for the CSP, approximately 12.99 millimeter here. And I suggest as a cyst in the CSP with no other intracranial structure abnormalities. So this is a cyst in the CSP. If we found the isolated agenesis of central velocity, mostly, in vast majority of the cases with apparently isolated the ASP, the progress is favorable. But additional anatomy is detected afterwards about the 14 of cases. So post the MRI confirmed is an isolated ASP, and the baby had normal neural development. This one is a feature of forebrain dilations. So it's found the hollow pericyclically. We can see the intact hypoecho structure is normal, but here's normal. It's a normal picture. It's a hollow pericyclically, but it's a fusion of lateral ventricle, salami fusion, and the southern ventricle fusion. The CF and CSF would not show, but the cerebellum can be visible in this section. So for the hollow pericyclically, it's a failure of brain division. And also, there are three main types: lobar, hemi-lobar, and lobulated. This lobar is the most severe. A lobar is the most severe, usually accompanied the facial anomalies, such as the cyclopia, like this, prop, and the eyes very close. Nose, mouth, usually we can see the abnormalities. So total holocentric syndrome, usually we give the diagnosis. And this one is very small cyst. But we down the 3D volume, we can see it's a problem. Like this. What's this? The eye picture very clear. It's also a smaller cyst. What's this? It's the same or not? We can see the break of the head scar and the thumb, the free tissues protrusion. So it's different. Like this, different. So if absent the CSP, we can use the color Doppler to understand. Yes, we can find the lower holoproscopy. We can see the picture. This one is normal pericolor some artery when the vascularization. But this one is abnormal. We can see the anterior cerebral artery and the rest of the front bone is very close to the skull. This size has been described as specific to semi-lobar and lobar holocentric. It's a new mark for the artery, the flow. This one is lobar HPE. We can see the first, functional here, the first funicle here. It's also use the parietal artery, and also we can use ultramicroangiography. It's very, very clear to see the sagittal view. And also you can find the corpus callosum is normal or abnormal. This is the parietal artery, CSP, corpus callosum here. It's artery cerebral anterioris. This is the ultramicro, the vessels to show. So thanks for the absent the CSP. Cares must be taken to avoid the mistaken the columns of the phonics for the CSP. It's a different play and gives the play for the columns of the phonics. We can see 3 lines, 3 acugenic lines here, 3 lines here, and the phonics also doesn't contain the fluid inside, but the CSP we can see is 2 acugenic lines here, and inside we can see the fluid inside. So it's different. So to take care to avoid the mistaken. It's also the test for the CSP. The absent septum here, we can see the picture. It's a cystic structure in the midline. It's a communicating frontal house. The phonics can be differentiated from the CSP by central third lines. It's phonics here, so we should take care. What's this? This picture. The cavern volume interpositing here, and this one is oral. We can see the cyst, but it's the cavern border here. Also also you can call the sixth ventricular. What's this? The cyst, positio cyst here. Here. The cyst structure in the midline is due to the deficiency in the roof of the third ventricle and the result and genesis of the corpus callosity. This one. So we should take care for the destruction of white matter. These pictures also you can see the cyst, but it's different. It's both the corridor plexus, both sides of the cyst. These iPage pictures. And also, we need to observe different anchors. There's a coronal plane and parasagittal plane for the brain. The echogenic license here, and the lateral ventricles enlarged here, like star, enlarge the subnoidal space, and mild ventricular magnet here. So this case is intracranial hemorrhage. This case is also intracranial hemorrhage. It's the unilateral intraventricular hemorrhage. It's 22 weeks gestation. This is three-dimensional picture. This is for MRI, and this is three-dimensional neurosonography. Just unilateral intraventricular hemorrhage. The ventricular magnet here, and we also use the 1K smart plate can measurement the ventricular, the widest here, lateral ventricular the widest, and the CSP can show everything. This is for the cytomegalovirus infection. Although only 10 to 15% of infected the features can show the symptom at birth, multiple organ can involved. Approximately 5% of the fetal ventricular magnet cases can be attributed to the fetal infection. This picture we can see. This is transvaginal ultrasound images. This is coronal, and the coronal, the wheel, perisagit. It also shows the periventricular hypoacusis acrogenicity, and the baby is 21 week gestation, and is the cytomegalovirus infection. The size here, usually intracranial calcification we can find, and bilateral periventricular cyst echo, enlargement of the liver and the spleen. Like this. This case is 28 weeks. We can see the periventricular acrogenicity and the cyst change. Cyst here, change. Let's see the video. A cyst here is genuine. Magic, like magic here. So. Periventricular acrogenicity and the cyst. Here, you can see it's a CMV. This is also for the fetal cytomegalovirus infection. A cyst here, and the liver and the spleen enlargement of the liver and the spleen, and the classification, many classification, intracranial classification, and the liver and the spleen classification. We also observe the CSP, the camera sector proceeding the shape. We need to see the shape. This shape, because the different shape is in direct size of partial genesis of the corpus callosum. This one here. Normally it's a square or triangle, but this one is wider. The length is smaller and the width is bigger. The measurement like here. This one is 23 weeks for the corpus callosum. It's a normal or abnormal? It's a normal. It's genuine. It's a coronal and sagittal view of normal for the corpus callosum. In the first trimester for the fetus, the early corpus callosum usually develops by directionally. Usually the posterior elongations is more significant than the anterior one. So it's special, very special, the corpus callosum. We can see the different configuration for the column artery. For this is 15 weeks gestation. We can see the color here, and here is the blue one. We can see the corpus callosum here. This artery is here, 15, 16 weeks. So the early patterns for the corpus callosum development. For the ACC, genesis of corpus callosum, we can several abnormalities may affect the corpus callosum, including complete or partial agenesis, and dysgenesis, including abnormal the shape, hyperplasia, and for the sink, maybe it's decreased the thickness. The malformation can be occur isolated and can also associated with Clemson syndrome, monogenic disorders, and maybe rarely secondary to infection. This cases is complete the ACC. We can't find the CSP, absence of the CSP here, and interrupted the needless separation for the frontal lobe. The picture is a label highlighting the widens for the interhemisphere space here for the space, and lungs usually dilated relatively to the anterior wall for the posterior wall, because it's first widened in the posterior halls for the lateral ventricle. So for these structures, we can get the mark is a teardrop like a teardrop configuration. So it's a indirect sign for the complete ACC. It's also a genesis of a corpus callosum. You can see the video. Absence of CSP, and the posterior half of both lateral ventricular expanse. So a teardrop shape, and the bounding part of the lateral ventricle is large. The third ventricle expands also and moves upwards. This baby is 25 weeks. Also, you can see the teardrop. It's complete ACC. Yeah, absent CSP, later ventricular enlargement, and also absent abnormal cause for the pericallosal artery. So we can see the cause, abnormal cause, is also confirmed by MRI. It's the teardrop in the indirect side. This is also complete ACC. The first picture absent CSP and the lateral ventricular enlargement, teardrop sign. The corpus callosum was not visual. This one is for the partial ACC and genesis of the corpus callosum. We can different shape, and we can see the artery, the course. Usually, this short, we can see this short corpus callosum. The posterior segment for the corpus callosum are usually missing, so just short one. It's a partial ACC. Oh, the eye page is very clear to show it's a short corpus callosum here. Very short and missing the posterior segment. This 24 weeks is also partial ACC. This is severe lateral ventricular enlargement and the interhemispheric cyst here, and the only portion of the corpus callosum was visualized, short one, and the cyst, interhemispheric cyst. This baby is 3-4 weeks. This is our hospital. We have MRI outcomes in 43 cases for the absent cavernous porosity. If we do ultrasound found the absent for the CSP, what we should